80% of the population has stated that they want to see more natural and integrative services in their medical and dental offices. There are people who are looking for these holistic approaches. Myofunctional therapy is actually a fantastic way to meet a nice middle ground to integrate something at a very low cost that's actually going to help your patients beyond what you would typically do in your restorative treatments.
Hello, everybody, and welcome to another episode of the Raving Patients Podcast. I want to thank our sponsors, both Dental Intelligence and the Doc Sites, for their support, allowing me to come to your inbox every single week at 5 a.m. Eastern Standard Time with a new episode. It's the beginning of November. We just finished up Supercharger Dental Practice in Scottsdale, Arizona, and I want to remind everybody that the 2025 event is September 26th and 27th. It's back in Florida, in Fort Lauderdale, actually, at Pier 66. Again, it's superchargerdentalpractice.com. You can check it out as we release the speakers and all the information. Check out superchargerdentalpractice.com to keep up to date with all the latest information about the event. It's going to be bigger and better than ever. My guest is Karese Laguerre, and we're going to be talking about myofunctional therapy and how it can help your practice. She is a registered dental hygienist and myofunctional therapist. She founded the Myo Spot, a practice aimed at amplifying oral wellness to whole body wellness. Through teletherapy, she helps clients of all ages overcome tongue ties, TMJ disorders, sleep apnea, grinding, anxiety, and various breathing and oral facial dysfunction. Passionate about education and self-help, she published Accomplished, How to Sleep Better, Eliminate Burnout, and Execute Good Goals. She's passionate about DEI. She co-founded Dental Culture Con. So please welcome to the Raving Patients Podcast, Karese Laguerre. Karese, thank you so much for joining me today.
Thank you for having me. Great introduction.
Why don't we start off with something that I think is really, I guess, an unknown in the dental space. What exactly is myofunctional therapy and how is it relevant to dentistry?
Myofunctional therapy is a wonderful modality of sorts, is what I'm going to call it, that originated actually in dentistry over a century ago with someone who you may be familiar with, Dr. Edward Engel. Now, if we remember what Engel is famous for, it's for classifying malocclusion. But he was also very curious as to what was causing the malocclusion. And so in his research and in that of a fellow prominent student of his, myofunctional therapy became a nice modality that kind of got to the root of what was causing changes or shifts in the way that the teeth were falling in line in the craniofacial structural growth. So that all led back into soft tissue. Soft tissue and the pressures that it exerts on the hard tissue structures of our cranium, that's actually what causes malocclusion in its various forms. So what I do as a myofunctional therapist is I'm kind of like a personal trainer, but for all the muscles below the eyes, but above the shoulders, to help work to strengthen and coordinate these muscles that are in this beautiful region here. That way we can have better oral function, eliminate compensatory patterns, and, breathe, sleep, eat, live better.
So I'm curious, why is it such an unknown, or why is it misunderstood, or why is there not much said about it? Because obviously we're talking about this part of the body, which is very dental related, but yet there's so little stuff talked about it. Why is that?
I think because it's very difficult to kind of understand. It feels like it crosses over so many boundaries. So when we're talking about dentistry, we are all, as clinicians, very tactile. So we want to get our hands on something. We know how to manipulate. We're all very creative as far as how everything happens with restoration. And then when we're helping patients to get back on the path towards health, we've got a lot of technical things that we can do. But when it comes to more abstract thinking, such as how do we change soft tissue function, that way we can alter that to now leverage what we do beyond that, eating, drinking, digestion, sleep, that feels like it crosses so many other boundaries. It sounds like a little bit of physical therapy. It sounds like some occupational therapy. It sounds like you're doing a whole lot of other things, but it doesn't necessarily sound like what it originated from, dentistry. And so I think that's where some of the push kind of comes from. It's like, well, this doesn't really feel like dentistry, but it's so interconnected into all that we do in the clinical day-to-day.
So are most myofunctional therapists, are they hygienists, or there are ones that are not? What is the connection to the dental industry? Is it very much hygienists looking to explore other things to do? Is it people who are just saying, I want to be a myofunctional therapist? So talk to me what's the connection there when it comes to dentistry?
Yeah, so dentistry, it connects in a lot of different facets, but where you do find most of your myofunctional therapists are registered dental hygienists or speech language pathologists. So registered dental hygienists, many of them do leverage it as a separate avenue of career growth. With so much in dentistry, we get the neck pain, the wrist pain, the upper back pain. And so it's a great way to kind of laterally transition to use all of the wonderful tools and things that we learned when we were in school. So all of that pharmacology, oral embryology, and so forth, bringing all that into function and how we can really help our patients in a way that's not so clinical and like having our hands in their mouths. It is a great way for some dentists to also leverage when they're working in the sleep and airway space. Now, when you think about the muscles below your eyes, above your shoulders, you got to recognize that all of that is also encompassing our upper respiratory tract. And so for those who are in the sleep and airway space, myofunctional therapy, because we're dealing with soft tissues and most of that upper respiratory tract is surrounded and filled with soft tissue, being able to have manipulative control over it, that's a big space in dentistry where they are using it the most currently.
So I know that you specifically founded something called the Myo Spot, which is that a separate location from a dental practice that you're working in? Is it can someone bring something like this into a dental practice and do it? Talk about that relationship with the dental industry. How exactly is it? Are dentists doing something in the practice? Is it a separate location? Give us that information.
So the Myo Spot specifically is something that is my own private practice that is outside of a dental office, but I've actually done myofunctional therapy almost every way you can think of. I also have done it in the dental practice in a multitude of roles. So it is something that you can incorporate in your dental practice. Most commonly, again, like I said, in sleep and airway practices, you'll see people bring it in. But then we also have cosmetic dentistry, orthodontists, and so forth, who will refer out and or bring someone into the practice on a consultant or per diem basis. That way you're able to have those services on site.
Got it. Okay, that makes a lot of sense. So let's talk about the integrative services as an innovative approach to practice growth, because obviously one of the things I like to talk about is how to, yes, it's online reviews, but I also like to help practices grow and make more money. I mean, that's what we want to do as a business. Why are we in business? To make more money. Why do you market? To make more money. Everything revolves around practice growth. So how can you use this as a way to really help grow a practice?
Oh, this is the perfect question. So in order to get good practice growth, you also have to be willing to innovate and willing to move along with the times. There is so much that dentistry can evolve into, but it's not tapping enough into the spaces of holistic or natural approaches to care. And what's interesting is that the National Institute of Health in 2022, when they last did one of their national surveys with over 200,000 people, 80% of the population has stated that they want to see more natural and integrative services in their medical and dental offices. So there are people who are looking for these holistic approaches. All of the social media marketing that you're doing, all of the Gen Z and those lower millennials that you're trying to market to, a lot of them are looking for these holistic services. But with dentistry, outside of going straight into having a holistic practice or maybe establishing a dental spa, myofunctional therapy is actually a fantastic way to meet a nice middle ground to integrate something at a very low cost that's actually going to help your patients beyond what you would typically do in your restorative treatment. So with myofunctional therapy and oral function, you could think of things like eliminating parafunctional habits. Those are big. We see those all the time. Those contribute largely to periodontal disease progression, to vertical bone loss, and so forth. That's a big one to be able to have a nice holistic response to, in lieu of something where you might just issue a mouth guard. But myofunctional therapy would provide significantly more as far as your revenue generation from that. And so it's a great talking point to have in your office, a great attraction to bring to the office. There's a lot of people who are naturally fearful of whatever's going on in the dental office. And so it's a great way to kind of meet a middle ground where you're doing something more natural that doesn't necessarily go invasively into their mouth. And so you can attract a broader audience and bring in more revenue.
That makes sense. So, and I just want to reiterate this. So you were working in a dental practice as a hygienist. Now you still work in a dental practice as a hygienist or no longer?
No, I'm no longer clinically hygiene.
No longer clinically hygiene. So you're full time in the Myo Spot, which is your, now how do you get patients? Do you get patients from other dentists? Do you get patients from hygienists? You know, what is the referral source for those patients?
It's a multitude of places, but mostly, yes, referrals. So referrals from other dentists, referrals from other practitioners. So we wind up building a nice team. And that's also a great way to get revenue generation because myofunctional therapists typically come along with naturopaths or manual therapists, osteopaths, and people who are already referring to Myo, who then wind up referring to the dental office for whatever other treatments that they need because we want to stay within our holistic team. And so it's a phenomenal revenue cycle.
Talk about the financial part of it. I'm curious, is it insurance driven? Is it cash driven? What is the revenue stream like for a visit? I'm only asking because I don't know.
Yeah, no, that's a great question. I think that most people are doing it as fee for service. And so it's a cash based service. And where I find people find the most success is when they're billing out for it as a low cost, as a continual monthly revenue. So you're building out a long-term monthly revenue stream and having the patients to have the ability to see the myofunctional therapist as needed. And so it's a fantastic way to build in an additional $1,500 to $2,500 extra annually per patient.
Got it. And what is like an individual visit cost on average? Is there a range that you see? Again, I know it's very dependent on where you're located and stuff as well, but talk through the initial visit. You're evaluating the patient, diagnosing them, and then you're going through exercises. I'm assuming some of this can be virtual as well, correct?
Oh, all of it can be virtual, technically. Okay. Yeah. But first visit, typically for an intake, it could be anywhere from $250 to $400. It depends, again, demographics where you're located. And then individual visits, I would say most people don't bill individually. When you bill individually, it winds up being like piecemealing services. And I might have somebody come in. They need 4 crowns. They only do 1 because that's what they can afford. We do bulk services, right? So we bulk it all out into a full program. And so that full program can be anywhere from $2,000 all the way up to $6,000 in some places in California. So it's a very big gap of the fee where it could be.
Interesting. Okay. Can you talk about some of the exercises that you have, because you mentioned occupational therapy. So they're obviously doing stuff, I'm assuming, with their tongue. So can you talk about or show some of the exercises that we're talking about here? I'm just curious because, again, I don't want to say I'm ignorant, but I just don't know. So can you talk about some of that stuff?
No, absolutely. So there's over 100 muscles in this wonderful complex region. Most of them are pairs, and we know the tongue. There's 8 different ones that are, innervating our tongue. And so we've got 16 different muscles we can work with, right? And a lot of people struggle with the back of the tongue. Most people don't know, including some dentists, that at rest, our tongue should be lightly suctioned up from the incisive papilla all the way back to the soft palate. And there's a lot of people who struggle with getting the middle of the back of the tongue up. So we'll do exercises for this specific example. We'll do exercises that will work and engage some of those back of the tongue muscles. Now, what I'm going to do is I'm going to have you open really wide, and I'm going to have you keep your mouth open while you say, ga, 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 like a hard N and a hard G.
Ga.
You should be able to see your uvula lift up, so your whole soft palate with your uvula lift up for that and then for that G, you'll see the back of your tongue rise. And it's an alternation between the two being able to engage. And these are muscles that nobody's ever working out. So you'll find that after doing it maybe 5 or 6 times, you'll start to feel like your tongue feels a little weird, a little fatigued. You want to close your jaw. You're like, what's going on? It's just like going to the gym, and which is why I love that personal trainer reference that I did earlier. Yeah, we're working out all of those muscles.
That's interesting. And obviously it can be done very much virtually like we're doing here. So that's so that's an interesting concept. just another question. Did COVID really help turn it into a virtual? Or was it even virtual before COVID?
It was virtual before COVID, but COVID helped significantly because I think we all really learned how to adapt and accept different therapies like this in this modality.
Got it. So, like I said, one of the big reasons why I wanted to have you on here was one, because of ignorance. I didn't know enough about this, and I learned so much of these when I do podcasts. It's ridiculous. But also because I think I'm looking always for interesting things to help a practice grow. Now, you took it upon yourself to open up your own practice. What percentage of myofunctional therapists are actually working in a dental practice, do you think, versus opening their own stuff? I'm curious because obviously this adds a whole, if you have the patients that actually need it, it adds a whole different revenue stream to the practice. So can you talk about that and also how someone can implement myofunctional therapies into their practice as another service they're offering?
Absolutely. Okay, so percentage-wise, I want to say most of the hygienists who do take a myofunctional therapy course are looking to integrate myofunctional therapy as a new career path. And so most of them do try to implement in a dental office, but the problem is not being the practice owner. And that sometimes that doesn't work out the way they want to. And so it winds up being where, some of those wind up converting into having their own space. Where you can implement and how you can implement into a dental practice, it can be a simple, same service revenue thing where you are having, while they're in the hygiene chair, they can have those conversations there. They can also start that sales process of talking about the myofunctional therapy and loosely get that started and booked and scheduled for another meeting or another appointment where they can come back for that consult. And so it winds up where you can have a separate day. Let's say the office is open Monday through Thursday. All day Friday, that hygienist can come in, and all day Friday now is seeing the patients for myofunctional therapy. That doesn't mean that they have to all come back that same day, that Friday. They can be seen, like you mentioned, with telehealth and teletherapy. And I think a lot of people do really appreciate that they're able to have the same people that work with them in the practice working on them on other things. And so it winds up being a good revenue cycle for just those additional days that when the office is closed, it can be open and generating revenue that's hands off for the practice owner.
That's really interesting. I think the biggest thing is you have to have a dentist that fully supports what it is. Because as you know, there's some, I don't want to say there's a lot of controversy over if it's actually dentistry or what. So, I think you need to find someone who actually supports you more than anything. And then I think you can take it from there and see what opportunities are available.
Absolutely. Because there's so many different ways it can be implemented and help out in dentistry.
Now, what about on the ortho side?
On ortho, it's fantastic. So orthodontic retention, a lot of that is based on the soft tissue pressures because that makes that influence on what's happening. So when we see orthodontic relapse, that's a lot of that. Helping to close open bites because sometimes the open bite is the soft tissue pressure that is that tongue thrust or the tongue not resting against the palate, resting against the teeth instead. And so there's a lot of applications for ortho expansion. The tongue and the pressure of the palate is going to help with expansion and expansion appliances. There's so many things we can do to help with ortho, oral habits. I mean, the list really could go on.
Interesting. It's really interesting to hear. So I know that you had, in the information that you provided me, you actually mentioned KPMG had made some predictions. So can you talk about what those are and how it affects the industry?
Yes, so KPMG is a leading consulting firm that's always doing research, very similar to a lot of the other big consulting names, Pricewaterhouse and so forth. And KPMG, very interestingly, made a prediction in last year's research on the medical, dental, and healthcare sectors. So within their research, they estimated that having integrative services such as myofunctional therapy in practices is going to be, by 2026, a $2.7 billion industry. And I don't think there's enough practices that are positioned right now to start to capture that. So it's incredible.
Got it. Where do you personally see, considering that you are involved in the industry and you do it in your own practice, where do you predict things are going to be in 5 and 10 years when it comes to your space?
5 to 10 years, you're going to see it happening a lot more in dental practices. I don't foresee a lot more independent myofunctional therapists. The days of independent myofunctional therapy is already looking like it's starting to wane, because when you can have these services in office, you want them in office. If you can have a periodontist come to your office, an endodontist come to your office, it's much better than sending them out, right? And so it's going to be a field where I see a lot more integration within dental, because the applications and how they can be utilized are becoming so much more prevalent.
That makes a lot of sense. And then the last question I have, there's some differences or there. Remember when I first met you, we were talking about it, and I think I refer to it as myofacial. There's obviously a difference for those that don't. There is a difference between myofacial and myofunctional. Can you just touch base on that to settle any controversy there as well?
Absolutely. Our myofunctional therapy is very hands-off. We're very verbal instruction, like a personal trainer. We're instructing on exercises. Whereas a myofacial therapy is going to involve hands-on. It's kind of, manually manipulative, just like a massage or craniosacral therapy might be.
That answers the question right there. One's hands-on, one's hands-off. Very, very, very clear delineation of that. What type of, for someone who's interested, they may be a hygienist listening to this and saying, wow, I never thought that I can do something on my own. I feel trapped in the operatory and I want to get out and do something differently, which is a very common theme nowadays. What type of schooling is required? What do you have to take? What type of classes do you take to become a myofunctional therapist?
So there are several organizations that offer courses. You have to take a certification course. Many of the courses are at minimum at 28 hours of CE. And so you would start off there. And then from there, there's continual learning. There's so many resources and places where you can learn and continue to grow beyond that.
And how many myofunctional therapists are there in the United States? Do you know?
That are actually practicing, I'm going to confidently say less than 400.
Wow. So it's a very small segment of the population.
Yes.
Very, very small. Interesting. Well, the reason that Karese and I had met was I had reached out to her about interested in learning about her event that she has in Miami, very close to where we live, called Dental Culture Con. And so can you spend a couple of minutes talking about when it is, who it's geared for, some of the speakers who are going to be there. So basically promote your event.
Thank you so much. So Dental Culture Con, I'm really passionate about. It's all about celebrating diversity in dentistry and really about enhancing the awareness of how you can really utilize and leverage that to build up your own personal culture, yes, but to build up a greater team, a greater workplace culture, and outwards, because it ripples out to the patient culture in your community. And so our event is going to be in Miami or Aventura, which is Miami pretty much. We're going to be in the Miami area February 7th to 8th, 2025. And it is a 2-day event that is really going to invigorate you with some really great speakers. Dr. Alan Stern is our opening keynote. He is going to talk about how we all need each other. I think that is such a wonderful way to open. And we have Lauren King, who's going to be our closing keynote, who is going to be talking about human trafficking, which is a CE requirement in Florida. So if you need that, please come. This is a wonderful team event. Come out, bring the team, make sure that you're all educating and learning about how you can really leverage what we think makes us different to really build more bridges, because we're more alike than we really feel.
And just give the dates so they know.
February 7th and the 8th, 2025.
February 7th and 8th, 2025 in Aventura at the Hilton, is it?
Yes.
At the Hilton, at the Hilton in Aventura. So, and it's dentalculturecon.com, correct?
Yes. That's it.
Perfect. Before we shift gears a little bit, is there anything that we didn't cover that you would like to discuss?
No, I think we covered a lot about myofunctional therapy.
I think we did too. I learned a whole lot. So for me, it was very good. So, all right. So as I mentioned to you, I do a lightning round Q&A. I have a app called Poddex. And basically, I'm going to ask you some business related questions. They're all completely business related. There's nothing inappropriate. The purpose of this is just for you to answer these questions fairly quickly. I want to get through 8 to 10 of them. And again, just answer real quick and we'll move on to the next one. Okay. So what is your definition of success? So how do you define success?
Being able to have autonomy over your day. I think that's success.
Okay. This is interesting. One, what is one thing that you continue to do even though it doesn't bring value to your life?
Oh, man. I continue, doesn't bring value. Why would I do it then? Oh, I don't know. I eat sweets. I love them.
When you were a kid, what was the first thing you wanted to be when you grew up?
President.
President.
President of the United States, yes.
Okay. All right. What has been your approach to marketing?
Being as authentic as possible. I think people are attracted to authenticity. And so I like being authentic more than I like being like pushy and salesy.
Okay. That works. Describe Mondays for you in one word.
Optimistic.
What profession do you think is the most undervalued today?
Myofunctional therapy.
I knew that was the answer. That was. How many hours a day do you work on average?
Got to be somewhere like 12 to 13.
Okay. Let's see. What else do we got here? If you had one piece of advice to someone who is just starting out, what would it be?
Always be looking to learn. I think that's the biggest piece.
Okay. That's good. What are you most excited about with your career right now? What keeps you up at night?
I am very excited about the momentum that is building. What keeps me up at night is really feeling like sometimes it's not enough. Like whatever I did in those 12, 13 hours might not have been enough.
Okay. This is one of the toughest questions I ask. So we'll see how you do here. If you had to open up a lemonade stand tomorrow, what would you call your lemonade stand?
Ooh. Sweet made lemonade.
Sweet made lemonade. Okay. Okay. I thought you were going to go like the lemon spot. Something like that. I think you would come off your name. So that's what I was thinking.
That's probably better.
If you could take a class on anything, what would it be?
I would probably try to learn a little bit more about anesthesiology. I don't know why. There's no purpose for it.
Okay. A couple more. Who would you love to collaborate with and what would you love to collaborate on?
I would love to collaborate with Lois Laney, phenomenal myofunctional therapist and just person. And I would love to collaborate on like creating more dynamic systems that really help people in a multitude of ways.
Okay. Last question, which I ask everyone. Okay. What is one subscription, could be either personal or business, one subscription you cannot live without?
My YouTube Premium. I hate commercials, and you can learn absolutely anything on YouTube. And so I expedite my learning with that.
Right.
YouTube
So you pay
Premium.
for YouTube Premium because you don't want to watch the commercials.
Exactly.
Good answer. Good answer. So, Karese, how can people find more about myofunctional therapy? How can they contact you? What's the best way to find out more about Dental Culture Con? Why don't you give your contact information so people can reach out to you?
Thank you. I'll lead with the most important, Dental Culture Con. You can follow us on social media. We are on LinkedIn and on Instagram and on Facebook, all at Dental Culture Con. You can look more and register, dentalculturecon.com. You can find out more about myofunctional therapy on my practice site, themyospot.com. You can follow me. I'm at the Myo Spot on all the social media platforms. However, if you follow me personally, like connect with me on LinkedIn, just use my name, Karese Laguerre. I offer free weekly lectures about myofunctional therapy. I go live every single week talking about it. There's over 40, nearly 45 hours currently and like records and replays that you can find on my LinkedIn. So if you're looking to learn more, that's the best place to find me.
And then I think you were going to offer a discount to podcast listeners from Dental Culture Con.
Yeah, absolutely. We can offer a discount for our listeners right now, dentalculturecon.com. If you go to dentalculturecon.com, I don't remember the promo code that I gave you.
Podcast.
You use the promo code podcast. You'll be able to save off the registration. Thank you so much. I forgot that promo code. Podcast.
That's right. That's why I brought it up. The podcast is 15% off registration.
Yes.
That's what it says. That's why I brought it up again. So
yes, and it's live. So use
it works. It works already.
Yes.
So guys, if you have any interest in Dental Culture Con, you can go to dentalculturecon.com and use the code podcast to save 15% on registration. It's in Aventura at the Hilton, February
7th and 8th,
2025. Okay. And if you have any interest in learning more about myofunctional therapy, please reach out to Karese. I'm sure she'll be able to give you assistance in that. I think it's great. I think it's a really cool way to bring more revenue into your practice. Really empower your hygienist as well to do more than just being a teeth cleaner. And I hate to say it like that, but that's what it is. So guys, if you like the episode, please share it. Please tell your friends about Dental Culture Con. Please tell your friends about, hey, myofunctional therapist as well. Please review us. Please like us. Please share the podcast. I would appreciate that from my perspective. We're almost entering season 8, which is hard to believe. This is November and January will begin season 8 already. So we've done a lot of these episodes. Please check it out. And again, I really enjoyed Karese being a guest. I really learned a lot myself, which I think is really important. And I always end my episodes with 2 words that I live my life by, and you should as well. Remember, your reputation matters. Until the next episode, Karese, thank you so much for joining me today, and we'll talk to everyone soon.